everything that we are doing in the healthcare space would not gain any traction, would not resonate with our people, without your support. And so I value your presence here with us today. Several months ago, the Anti-Quackery Committee of the Rivers State Ministry of Health was inaugurated. It was inaugurated because we had realized that we had a massive problem within our health sector. The proliferation of quack medical practices and medical practitioners jeopardizing the lives of people living and working in Rivers State. So today we have convened this press briefing to update you on certain activities from the Anti-Quackery Committee. Facilities have been sealed, and I will be sharing details and reasons why those facilities were sealed by the committee. The first is Pale Hospital and Maternity, located at Ogale, Eleme local government area. There, they were practicing unsupervised against the provisions of the Medical and Dental Council of Nigeria, which requires licenses to practice medically. They were conducting surgeries without documentation and proper review. It was an unregistered hospital, meaning that it was not registered with the Rivers State Ministry of Health. The environment was unsanitary, and it provided a training school for quacks. So not only were they practicing quackery, they were churning out others to go forth and do the same. They were self-advertising, running a social media channel through which they advertised themselves and their services and attracted people to their facility. Dr. John Friday Ogundayo, an alleged graduate of Abia State University, who had issues as an intern at the Rivers State University Teaching Hospital and completed only 2 postings, significantly less than the required number of postings to be completed for full licensing by the Medical and Dental Council of Nigeria, is the culprit behind this hospital and maternity. The second is Success Maternity at Aleto Eleme in Eleme local government area. Also an unregistered maternity with no standards of operation, an unsanitary environment, also providing training for quacks, and the person running this facility parading as a medical doctor in the person of Mrs. Oke Oji, with a PhD holder and a retired nurse. The third facility, Noble Life Maternity and Computer Test, also in Aleto in Eleme local government area. Unregistered, run by a homeopathic practitioner, Mr. Hyacinth Egbemo, who paraded himself as a medical doctor and used regulated prescription drugs, injections, and intravenous infusions. The fourth, Futurist Medical Center in Omagwa, Ikwere local government area, also unregistered, run by an unlicensed practitioner, Mr. Future Amoyo, who holds a Bachelor of Science degree in agriculture. He ran outpatient clinics, offered home care, provided training for quacks, and also used regulated prescription medicines, injections, and intravenous infusions. The fifth, God Bless Hospital, located in the Komkom area of Oyibo local government area. An unregistered facility run by unlicensed practitioners alleged to be 2 foreigners and 1 Nigerian. No qualified or registered medical personnel on site. Unhygienic and unsanitary environment, the lack of standard precautions, multiple exposed sharps and uncapped needles littered around the facility. This facility also recycled and reused syringes and needles, intravenous infusion sets, and blood giving sets, run by so-called Dr. Kim, reputed to be a North Korean citizen, and his cohorts. Dasha Specialist Hospital, located at La Quinta Street in Afam in Oyibo local government area, run by an unlicensed foreign-trained medical practitioner, Dr. Temple Gimbe Baridumene, allegedly trained at the University of Kyiv in Ukraine, holds no registration from the Medical and Dental Council of Nigeria, has no internship experience, has no discharge certificate from the National Youth Service Corps, conducts surgeries unsupervised and without training. The facility has an unsanitary environment, and also the facility provided a training school for quacks. We can see that these perpetrators have gone beyond providing these unprofessional, unethical, and disastrous services to the people. Beyond that, they provide training, further proliferating their numbers so that other people can go into other locations and do the same. And if you've also observed the trend, a lot of them are going out of the main city of Port Harcourt, perhaps to evade notice and being brought to book by the authorities. We therefore use this medium to warn all unregistered facilities to visit the Rivers State Ministry of Health for the conditions and the criteria for registration, as I will use today's press briefing to reiterate that the Rivers State government maintains a zero tolerance for quacks and unregistered facilities. We also warn medical doctors and other health workers who collaborate, train, and collude with quacks and facilities run by unqualified practitioners against crossing the lines of ethical medical practice. We also use this opportunity to warn pharmacies and chemist shops who have illegally extended their services to providing consultation services and the administration of intravenous medications, admitting patients. We are therefore warning them to desist from such practices or be brought to book. We also inform the public that the Rivers State Contributory Health Protection Program, RIFCHIP, is functional and active following His Excellency Governor Siminalayi Fubara's approval of its takeoff in January 2024. The public is hereby advised to get enrolled to enjoy the benefits of revitalized health services in our public facilities, as Rivers State boasts of one of the best primary health care and referral systems, including a revitalized emergency medical service and ambulance system, in line with the mandate of His Excellency, to promote accessible and affordable healthcare services in safe and standard healthcare facilities while preventing exploitation from quacks. We also advise government agencies such as the National Health Insurance Authority, schools, and higher institutions of learning corporate organizations to ensure that any facility that they are signing up with or transacting with has been registered with the Rivers State Ministry of Health and issued with certificate of standard. All individuals and organizations who intend to execute free medical outreaches are advised to apply for clearance from the Department of Medical Services at the Rivers State Ministry of Health, as minimum standards of care and services must be ensured for all citizens and residents of Rivers State. Thank you, and God bless you all.